Hey guys, this is Manu Kalia, physical therapist and Ayurveda herbalist. So first of all, Merry Christmas and Happy Holidays. Hope you guys are having an awesome holiday season. So in this video, I wanted to talk about a common problem that I get to see a lot in my practice, which is runner's knee pain. So but I'm going to share a story with you guys first, tell you about one of my patients, and then discuss some of the common issues related to runner's knee pain. And then what are some of the solutions that you need to think about. So this is one of my patients who came to me some time ago, and he had been having pain in both his knees as a result of his running. So the gentleman's in his 40s, and he decided that since over the last 10 to 15 years, he'd kind of let himself go. He's got a sedentary job, so he sits a lot. So since he'd been sitting and he hadn't been doing much in terms of exercising or eating healthy, he'd put on a lot of weight. He had just felt slow, sluggish. His high blood pressure had gone up and high cholesterol, so he was taking medications for those things. And he had just gotten deconditioned and started to have all these health issues. So he decided that he wanted to make some changes in his life. So he went on a vegan diet. He tried a couple of different things. He tried a vegetarian diet. He was doing a vegan diet. After that, he decided he was going to start running for exercise. And not only would that help him get in better shape, but it would also help him lose some weight. And also, since he had a stressful job, it was a good way for him to do some decompression and stress management. And that was one of the things that resonated with him, and he wanted to try it. So he initially went really well. So he started running, and over a course of a few weeks, he started to lose some weight. He started to feel better. But then after a month or two, a couple of months, I think, as he increased the mileage, he started to push himself more. He started noticing some pain in one of his knees. Actually, it was his right knee. He started feeling some pain. So he backed off a bit. He took some anti-inflammatories and stuff. It eased off, but the moment he started to go back to running and pushing himself, he started feeling some pain. So he modified his training a little bit, and he tried to mix it up, running outside and maybe running on a treadmill. So as well as backing off and on the amount of mileage he was doing. So he was able to manage it for a little bit, but he continued to have some irritation, and it just wasn't going away. So, but as he kept pushing through it, kept trying, he started noticing the other knee was starting to hurt also. And over the course of a few weeks after that, he not only did he start having pain in both knees with the running, he started noticing that in day-to-day life too. So if he stood for too long, he would have pain. Squatting, going up and down stairs, kneeling, any of these things started to cause him some discomfort. So from a problem that was mainly with the running, with a higher level activity, it turned into a problem that it was starting to affect his daily life now. So now not only was he not able to start working on his weight loss that he was trying to achieve, he was starting to have more problems with just daily life functioning too. So that's when he came to see me, and so we decided to do an assessment on his not only on what he was doing in terms of his training, and also but to address some of the core issues we needed to look at for his knee problem. So runner's knee pain, which is commonly called, it's usually patellofemoral dysfunction or patellofemoral pain syndrome. So your patella is your kneecap, and the femur is the thigh bone. So the kneecap sits in the groove created by the thigh bone. And so that's a joint that's created between the main joint of your knee, and the kneecap sits on top. So it's that irritation of that kneecap moving up and down, whether it's off alignment a little bit, or it's just excessive movement going on, or there's an imbalance in the local muscles and the soft tissues taking place, starts to set up an irritation process. So that could be painful. You can have swelling, you can have thickening of the tissue. Not only can you have local pain around the knee or the front of the knee, but also it'll radiate to the back of the knee sometimes. So not only did he have the pain in the front of the knee along the kneecap, as well on the patellar tendon, which sits underneath the kneecap, which is also a common presentation with this problem. But he also started having some pain on the inside of the knee. So a lot of these different things were going on, and he was getting some swelling in those joints. So first of all, obviously we had to look at addressing his training issues. So what you have to think about is not just addressing what's happening locally at that joint, at the knee itself, whether it's the femur and the tibia, the main joint, or the patellofemoral joint on top of that, or the quadricep muscles that make up that sit on top or on the front of your thigh, or your hamstring muscles, right, or the calf underneath that. So those are local muscles at that joint, right? As well as your IT band that crosses on the outside, your adductors on the inside. So a lot of these guys are local groups. So yeah, you have to address what's happening locally at that joint. But often the problem has to be addressed above and below the joint always. So you have to address what's happening at the foot, what's happening at the foot mechanics. Does the person have a high arch? Do they have flat feet, or the muscles locally or distally at the foot are weak? They're not doing their job, or they don't have an adequate mobility or flexibility at that ankle, which will affect what happens at the knee too. So, or you have to go above the chain at the hip. So often there's hip tightness and hip weakness, which is a very common problem with a lot of these issues. So you need to address a lot of those issues also. In addition to taking care of the problem locally by strengthening flexibility, as well as hands-on manual techniques like cross-friction massage, or just different types of tack and stretch pump massage techniques. I find also a lot of effectiveness with using herbal oils at the joint. And then oral supplementation also can be quite helpful for these conditions. So there has to be a training end that has to be addressed, which is part of the rehab, and then leading into that training end, as well as mechanical issues, how you want to control those by either what type of shoes you choose, or some initially taping techniques you might decide to do to take the pressure off the patella or the patellar tendon. So start thinking about it more, not just locally, globally, what you want to address with this problem. Okay, so go up below and above the chain. You got to go. You have to go up to the hip. You got to go up to the spine. You have scoliotic changes, and what else is happening at that individual. Especially if you're going to start putting a lot of miles in. If you're going to put a lot of miles into this, you have to really make sure the rest of the system is functioning very well. You're strong and flexible, that you can handle all that pounding and all that mileage you're going to put onto that joint, right? So we were able to address my patient's issues, and we were able to get him back to running again. But we did have to assess and analyze a few things in terms of the common problems that were happening with him regarding his feet, regarding the hips. And this is something you want to think about in terms of angulation. And there are various reasons, and I'll list some of these in the notes. And you can also check out on my site. I'll put them up on the site too. But besides the feet, besides the tightness or weakness and all these issues, structural issues. So for women, for example, women have wider hips. So the Q angle, which is essentially the angle created by the width of the hips and the legs that are coming down from that point. So if there is the wider hips and the legs are drifting inwards more, it's going to increase the load on the inside of that joint often. But it can also change the angulation or line of pull of that kneecap, how it's gliding up and down. Okay, because you're changing the line of hip. The structural change causes a change in the line of pull of that kneecap. Doesn't always cause problems, but it can be an issue. So some of those things have to be looked at and addressed too. All right. So I hope it gives you at least an overview into what you need to think about, you need to look at regarding runner's knee pain, often called, as I mentioned, patellofemoral syndrome or patellofemoral pain, or chondromalacia patella, right? Which is basically the degeneration or softening of the cartilage underneath the kneecap. So if you have any questions, leave a message, leave a comment, and make sure you subscribe to the channel. and keep watching the videos. Thanks, guys, and happy holidays.